I'm Dr. Priyanka Shah, vitreoretinal surgeon and ROP consultant at Advanced Center for Eye Care, Mulund. Today, I'd like to speak to you about taking care of your eyesight and protecting it for life on occasion of World Sight Day. First of all, what is eyesight? Why is it so difficult? Why is it so important to look after your eyesight and your eyes in general? Vision is like a window to the world. If we don't see, it is one of the most important senses of our body. If we can't see, we're very much handicapped. So that is why your vision is very important, and having a good, clear vision is very, very important. What is the whole hue and cry about this World Sight Day? What is World Sight Day? It is basically an annual global event which draws attention on blindness and visual impairment. It is celebrated to create awareness about eye care, vision, blindness, and treatments involved in curing eye impairments. Uh, as we go ahead with this talk, we will realize a lot of the causes for visual impairment are very much treatable if they are detected and treated on time. Hence, it is important that we pay attention to our eyesight, our eyes, and preserve them. Globally, about 2.2 billion people have an unaddressed vision impairment or blindness. Among these, 1 billion people have vision impairment which could have been avoided, as we spoke shortly. And about 1.1 million people in India are cornea blind. So this is a very large number. The current annual transplant number is 25,000 per year. So obviously, where we have 1.1 million of cornea blindness, and only 25,000 are undergoing transplant. So that means we need more cornea donors. So this is one of the objectives of World Sight Day as well, to produce awareness regarding cornea blindness as well, and how we as people could, with eye donation, could help reduce the blindness burden in our country. Now, how do we see? So, if you see this small diagrammatic representation here, uh, when we see the actual image, what our eyes see is an inverted image. The back portion of the eye, which is called the retina, it perceives these images as we see them. It is seen in an inverted shape. It then processes to go towards our brain, where our brain processes it and gives it the actual shape that we see. So this is a diagrammatic representation of our eye, wherein if we see, this front portion is the transparent part of the eye, which is called the cornea. So this is the transparent part, which is called the cornea. This is the only part of the eye which can be transplanted. This is the lens of the eye, which is responsible for relaying light and focusing it onto the retina. This is where the cataract occurs, which is a very routine age-related change. So this is where the cataract occurs. Moving ahead, this innermost layer of the retina, of the eye, is called the retina. This is responsible for producing our vision and sending it through the optic nerve towards the brain. So we'll go towards common eye problems. Their problems are very different in children and older people. Uh, Very common being refractive errors like myopia, hyperopia, astigmatism, dry eyes, digital strain in the eyes, allergic conjunctivitis. These are all due to the lockdown situation recently and increased usage of screen, especially in kids and adults working from home. We've been seeing a lot of digital strain in the eyes, dry eyes, and refractive errors surfacing in children. Color blindness and night blindness are pretty much inborn impairments of vision, which cannot be treated as such. In children, commonest eye problems could be, first of all, refractive errors, as we already spoke. That is, either inability to see distance or inability to see near, or something which is called astigmatism, wherein because of the curvature of the cornea, there is a number in which, in a particular axis, the images are not well focused. All of these three need to be treated with the use of glasses. If it is not detected and treated on time, it leads to something which is called amblyopia, or in common words, lazy eyes. Amblyopia is reversible up till the age of 6 years. 6 to 12 years, it is partially reversible. Beyond 12 years, it is not reversible. Hence, it is important to detect these refractive errors well in time. So, it is always recommended for children to have at least an annual eye checkup. If your child has a refractive error or glasses, then they must have more frequent checkups as advised by an ophthalmologist. Another common problem is squint or strabismus. Now, what exactly is squint? As you can see in some of these pictures, one of the eyes is turned inwards or outwards, or both of them could be turned inwards or outwards. Basically, the eyes are not aligned with each other. This can also cause visual impairment, which may be permanent. Ptosis is drooping of eyelid, downward drooping of the eyelid, seen in the second picture here. It is surgically treatable, and if it is severe, such that it covers the central part of your eye, which is called the pupil, and it does not allow light to pass through to the retina, then the child can turn amblyopic in future. Some of the common problems in older people are uncorrected refractive errors. So, if as a child or even later in life, if they have had a refractive error, they do get a number for the glasses and it's not corrected, it can definitely lead to amblyopia in adults as well. Presbyopia is something which we get beyond the age of 40 years and beyond. Why does this happen? When we see for distance, the muscles inside our eyes are relaxed. When we have to look at nearer objects, the muscles inside our eyes have to contract such that it helps our eye focus near objects. Now, as we grow older, these muscles they relax, they become weaker, and hence there is something which is called presbyopia. So, because of which the muscles cannot contract, and hence we need glasses to see for near. So, as one ages, almost every 2 to 2.5 years, the number will keep on increasing up till the age of about 60, after which the number is stable. The next one is cataract. Cataract is, after refractive errors, second most common cause of blindness, especially in India. There is a large untreated cataracts which are seen, large burden of untreated cataracts. which are causing blindness. So, especially in the rural areas, peripheral areas where medical facilities are sparsely available, there is a large burden of cataract which we need to address. Now, what is cataract? As I showed you in a previous slide, it is basically opacification or clouding of the natural lens. The natural lens is supposed to be transparent. If it becomes opaque, it is called cataract. This is usually age related. There are some other causes of cataract as well, but usually it is age related. The way we have graying of hair, similarly, we have the cataracts which form. The only form of treatment for cataract is via cataract surgery. The opacified or the cloudy lens is removed with the help of a surgery, and another artificial transparent intraocular lens is implanted inside the eye, which gives clear vision. The next cause being glaucoma. Glaucoma is also one of the leading causes of blindness or visual impairment. Why glaucoma is a very dangerous rather disease is because if someone who does not have regular eye checkups, they will never know they have glaucoma. They will never realize what the symptoms are, what the problem is, until they reach the last stage, wherein their visual is severely impaired. So we'll speak a little more in detail about this a little later. Another very important cause for visual impairment in older people is something which is called age-related macular degeneration, wherein there is degeneration or age-related changes, aging changes in the central part of the retina. uh, this is seen in two varieties. One is dry ARMD and one is wet ARMD. Dry ARMD usually does not require treatment as such. Often, nutritional supplements in the form of antioxidants and minerals are prescribed to help maintain the health of the retina. If one gets something which is called wet ARMD, then injections inside the eye have to be given in order to dry off the fluid which is being secreted. The next common cause for visual impairment, and which is slowly emerging as one of the very, very common causes of severe visual impairment, which is diabetic retinopathy. India is very steadily becoming the diabetes capital of the world, wherein the burden of diabetes in especially our young people is really increasing. In such people, the diabetic retinopathy is seen more often. We will speak a little more in detail about it a little later. So, just to in short tell you about refractive errors, myopia or nearsightedness. Uh, we see that the light, which is normally supposed to be focused clearly onto the retina, it is in myopia. It is seen to focus in front of the retina, because of which images are blurred. So one has to wear minus power glasses which will correct your vision and make your vision sharp again. Another way of treating it is with the help of contact lenses. Of course, these we advise only in older individuals who are able to take care of their contact lenses, because we need to avoid any sort of infections in the eye. Above the age of 21 years, 18 years is a theoretical sort of limit, but practically more often we advise that age limit of 21 is more appropriate for a laser surgery to permanently treat the myopia. Hyperopia or farsightedness. In this, the rays of light are focused behind the retina, because of which because of which vision is blurred. So distance vision is clear, near vision is a little blurred. So in this, a patient has to wear plus power lenses, and above the age of 21 years, again, laser surgery could be an option. Amblyopia or lazy eye, as I already mentioned, is it could have multiple reasons. Commonest reason being an undetected refractive error, that is an undetected number. So in such cases, we have to give the glass prescription, and a sort of exercise needs to be done for the eye in the form of uh, patching of the good eye, that is covering of the good eye, is done in order to stimulate the amblyopic eye to see well. Now, very good and accurate softwares are available to help exercise or stimulate the amblyopic eye, and hence patching is not required to be done. So such softwares are extremely helpful, where a patient could either come into the clinic and do these amblyopia exercises, or they can be allotted these exercises to do at home. The doctor gets the reports. So many of these treatment modalities are now available. What is most important is amblyopia, and the cause of amblyopia needs to be detected as early as possible. Astigmatism is, as I already told you, it is basically due to the shape or the curvature of the cornea, wherein in one axis the image is not uh, sharply focused. This requires it is treated with the help of glasses or contact lenses. Similarly, refractive surgery could also be an option, but high cylinders are preferably not treated with the help of refractive surgery. Squint, as we already discussed, is basically misalignment of the two eyes. There could be multiple causes for your squint. So, correct evaluation for the reason for the squinting to occur needs to be seen, and the correct timing of the treatment, whether the child needs just glasses or glasses with patching or amblyopia therapy, or whether a child needs eye muscle surgery. So that is determined by your strabismologist. Ptosis, again, seen quite commonly in children, that is the downward drooping of the eyelids. This is corrected with the help of surgery. Coming to corneal ulcers, especially in the more peripheral areas where people go farming, these corneal ulcers are very common. Also seen due to injury to the eye, or in some contact lens wearers where they have not been taking care of the hygiene of the lenses, can also cause corneal ulcers. It is basically infection of the cornea, and it may lead to permanent opacification, that is permanent white spot on the cornea, and can finally lead to visual impairment. Conjunctivitis or pink eye is a very common cause. It does not always cause visual impairment. It is usually uh, what do you say, it is usually self-limiting, and if it is a bacterial infection, then it needs to be treated with the help of antibiotics. So conjunctivitis is usually treated with the help of antibiotic eye drops. Allergic conjunctivitis is another entity. None of these cause any sort of severe visual impairment. Cataract, as we already discussed, is the clouding of a normally clear lens of the eye, and it can be treated with the help of cataract surgery. So, what are the symptoms? You may ask, how will I know that I may have a cataract? It causes blurred or cloudy vision or dim vision, or it may cause halos around lights when you step out at night. You may feel excessive glare. You may feel that everything looks very faded. Your bed sheets, your walls, they all look very faded. So these could be symptoms of a cataract. Also, frequently changing number glasses of the number of your glasses could also indicate cataract. So, as we discussed, eye surgery is the only way to treat cataract. How do we do the surgery? It is with the help of something which is called phacoemulsification. That is, with the help of a machine. There is an ultrasound probe which liquefies the lens and sucks it out of the eye. So, with the present extremely advanced technology, it is possible to do these cataract surgeries through very, very small incisions, which are only 2 millimeters long. After the cloudy lens is removed, intraocular lens is implanted into the eye in place of the natural lens, which helps to see clearly. So these are the steps of the cataract surgery. The upper steps are of a femtosecond laser assisted cataract surgery, wherein the incisions and the pieces of the cataract are made using the femtosecond laser, followed by the machine which liquefies the cataract, and then implantation of the intraocular lens. Uh, Nowadays, majority of the cases need not be patched like this after surgery, as we do surgeries under topical anesthesia. That means under the anesthetic effect of eye drops. So we don't need to give you any injections. We don't need to put an iPad after the surgery. Patient comes out wearing clear glasses and seeing very well immediately after the surgery. The recovery period in such patients is very less, and hence patients are very happy since the last few years where topical cataract surgery has overtaken surgery done under local anesthesia. Now, glaucoma is another very important cause of visual impairment. Why important? Because, as I already told you, it is also called a silent thief of sight. That means very silently he keeps progressing till the patient has advanced glaucoma, wherein just a central tunnel of vision is left, beyond which all the field of vision is lost. Now, what is glaucoma and how does this occur? In glaucoma, there is increased pressure inside the eye, which damages the optic nerve and which causes uh, visual field changes. How do we treat it? It is usually treated with the help of eye drops, which need to be put almost all lifelong. If it is not responding well enough to drops, or if patient is unable to put the drops properly, then anti-glaucoma surgeries are indicated. In recent times, there are many glaucoma implants and many technological advances in glaucoma surgery which are occurring, which helps to increase the compliance of the patients with the treatment and reducing the need for eye drops. So, how do we detect whether you have glaucoma? First and foremost, the tonometry or measurement of the pressure of your eye is the first most important factor which is seen. If your eye pressure is increased, then further workup for your glaucoma is done. Gonioscopy, as seen in the upper second picture, is where the angles of your eye are checked for any narrowness of their of the outflow path of the fluid. The lower picture shows visual field testing of the patient, wherein if a patient has glaucoma, then some parts of their visual field are lost, and it can help to detect glaucoma. Next, we come to age-related macular degeneration. As already discussed, there are two types, dry ARMD and wet ARMD. Dry ARMD, there is waste products which collect underneath the macula, disrupt the normal functioning of the retina, uh, leading to some drop in vision. Whereas wet ARMD is the more severe part, wherein new blood vessels start growing behind the retina, causing swelling, bleeding, and scarring at the central part of the retina, which causes rapid visual changes. Now, diagnosis is done with the help of course, clinically, with the help of optical coherence tomography. In some cases, fluorescein angiography of the eye is needed to be done. In terms of treatment for dry ARMD, there is no treatment as such. Some nutritional supplements are often prescribed to help maintain the health of the retina. Whereas for wet ARMD, injections inside the eye are the only mode of treatment to treat the wet ARMD, to dry off the fluid which is being secreted by these new vessels in the ARMD. Diabetic retinopathy, as I already said, is emerging as one of the very common causes of impairment in diabetics. Initially, there may be no symptoms or very mild symptoms, but it occurs in a large spectrum, over a large spectrum, from ranging from mild to very severe. And then there is something which is called proliferative diabetic retinopathy. It could cause spots or dark strings of floating in your vision, which are called floaters, blurred vision, fluctuating vision, impaired color vision, dark or empty areas seen in your vision. So every diabetic, number one, must have a yearly eye examination to make sure there are no diabetic retinopathy changes. Once you get diabetic retinopathy, as per your ophthalmologist's advice, you need to have a close follow-up of your eyes, just to make sure your eyes are not worsening, you're not getting swelling in the central part of the retina. So, any sort of visual impairment due to swelling or any new vessels being formed leading to proliferative diabetic retinopathy need to be treated on time. Otherwise, permanent visual impairment can occur. Strict control of blood sugar, blood pressure, and cholesterol is the key to have healthy vision in your eyes in spite of your diabetes. Another common complaint seen recently is eye strain. This is usually because of increased screen time, especially in the pandemic situation, with uncorrected small refractive errors. So it causes immense amount of eye strain. So, as we often tell our patients to follow the 20-20-20 rule. That means every 20 minutes, look far away into the distance, about 20 feet away, for 20 seconds. This will help relax your eyes and reduce the strain. So, overexposure to your screen can harm your eyes and cause various symptoms. If you have any of these symptoms, you must definitely consult the ophthalmologist. Often, lubricating eye drops are prescribed to prevent eye strain, but then first and foremost, more importantly, the 20-20-20 rule needs to be followed. Uh, Now, when we see all these common causes of visual impairment, one common thing that ties all of these together is early detection and early treatment is the key to maintaining your vision. And how do we do this? It is with the help of regular eye checkups. So, for children, once every year, adults once in year or maybe once every 2 years. Beyond the age of 40, definitely once a year to rule out your eye pressure and any other retina related problems. Uh, just as we close our topic, I would like to request each and everyone watching this talk to take a pledge to donate your eyes and light up the world of someone else. Uh, this will help the visually impaired to see the beauty of life. Thank you.